And then a lot of times people come in and they'll be like, oh, I can't bite down all the way. Or, my bite is off, I feel like it's crooked. And sometimes that can be because of a muscle spasm, kind of deep back in your jaw that's creating the shift in your jaw. Usually when people have jaw issues, we like to make sure we check their insurance and make sure that if a lot of dentists will refer directly to us if the insurance calls for a medical doctor referral. We will seek that out for you. And then some insurances just allow you to self-refer. So we'll check that out for you, make sure that's all okay. But definitely, the sooner that you take care of these problems, the easier and the quicker you'll overcome it. Acute versus chronic. The more chronic it is, if you've been waiting for a year or a couple years, we can improve you, but it just may take a little bit longer versus if you came in, a month after your symptoms started. So we are always advocates for go get it looked at least. It might only take a couple sessions and then you're good to go, but get it looked at. So just from my standpoint, as a physical therapist, if you do get referred to our clinic to be seen for your TMD, what I will do is I'll take you in a room and we'll do an evaluation. We'll review your history. We'll talk about when it started, what was going on at that time, your symptoms. We will go over those oral habits that you might have. You might not be aware of some of the things that you're doing that could be contributing to your TMD. And we're going to kind of find out what's going on and why. When you can find out the why, that's treating the whole picture. And then we get in, once we find out the why, like why is this happening? It might be a handful of reasons, and I might not be able to pinpoint like, oh, this is why. But if we kind of have a general idea of what's going on and what's going on with your joint, then we can treat the pain, the muscle tightness, and the mobility issues. I will measure and get an objective measurement to see kind of where you're at when we start. I will watch how your jaw moves. A lot of times that will tell us, what side or what's going on, or where the popping's happening in your range of motion. I will feel muscles on the outside, and I'll also put some gloves on and I'll feel some of the muscles on the inside. And it's very interesting because people are like, oh wow, I didn't realize that I had pain down there. That's really sore. So that's not always fun, but it's not as bad as a dentist. So I'm not as hard on you. No, it can be sore, but it's fun to kind of see. And I might have some of you come up here and I'll point out a couple muscles inside the mouth and see how that feels. So we'll treat that, and then I'm big on educating on those contributing factors like the chewing gum, the unilateral chewing, sleeping. We don't want to be sleeping on our stomachs. So we really dive into what you're doing every day. Because I can treat you twice a week. You can see your dentist every few months, but it's really what you're doing every day that's going to make a difference in your symptoms. So a lot of education on what you're doing and ways to stop it. I do home programs because, again, it's something that you should be thinking about, being mindful about every day, and that you should be working on every day. If you want to get better, you have to be in control of your body and what you're doing. And I'm here to just give you the tools, and it's you guys who will take that and hopefully run with it. We'll go over some stress reduction techniques if you guys are stressing out a little bit with life. And then, typically in 6 to 8 visits, I usually know if PT is going to work for you or not. I'm very honest with you. I don't want you to keep coming if you're not getting better. However, a lot of patients do really, really well with PT. And we work directly with our dentists, and sometimes splint therapy with physical therapy is a really great combination, and it can be a great way to conservatively treat your TMD. However, if the corresponds with the dentist and we're having issues and we just can't move past a certain point, we'll definitely talk to you about further options, and usually I refer you back to your dentist or your doctor, and we look a little bit into that. But we're very good about communicating with each other if there's any issues. Dentists are really, and I'm not just saying that because you're here, but dentists are really good to work with. They're very personable, very approachable. They're willing to work with you and hear you out, and they're easy to contact as well. They get back to you on a pretty daily basis. So yeah, that is what PT can do for you.